So, hello, my name is Kimberly Werner. I am a licensed creative arts therapist and board certified music therapist.
Oh, hi there.
And I have trigeminal and occipital neuralgia.
This is almost probably exactly what we did in session one, honestly.
This is nicknamed the suicide disease because the pain level can be so severe.
All right, I'm gonna have you open wide, but not as wide as possible, so a little bit wider. We all live inside a body, and every body comes with challenges. Hi there, this is David, the owner of Bodyworks DW, and we are here with Kimberly Werner, who is a fabulous client who has an amazing story. And we're here for another Challenge of Being You podcast episode. So in these episodes, we basically like to talk about the kind of issues you're dealing with, how they impact you, whether massage can help you or not, how that goes, and then we'll do some postural analysis and then a treatment on camera for everybody to sort of see. And the goal here is to collect interesting stories, but also show how medical massage can help certain issues and sometimes not, and what the real boundaries of that are. So basically, Harry will cut that together better than what I just said. So hi. One more little caveat. I do have a list of notes here with extra questions just in case I lose my way. So if you see me referring to my phone, I'm not answering texts. So can you introduce yourself and tell us all a little bit about you, what sort of issues you were dealing with that had you seek us out and sort of introduce yourself to me, but also a little bit about your background and just kind of give a little bit of an overview before we dig in.
So, hello, my name is Kimberly Werner. I am a licensed creative arts therapist and board certified music therapist. I work in a pediatric hospital with a wide variety of populations, but primarily sick children. Mm-hmm. And I spend a lot of my day playing guitar, playing music in really awkward body positions.
Yeah.
Lots of forward and lots of like hunched over. And I have trigeminal and occipital neuralgia, mm-hmm. which is an issue up here in the back of my neck and in my head and brain, I guess, that causes a lot of tingling and numbness and sort of stabby, shooty pain all along the right side of my face. And I've got some involvement that kind of goes into my right arm and shoulder, which, like I sort of mentioned, in this terrible, what I would say terrible position, spending 25, 30 hours a week, the flare of it makes my job sometimes unbearable.
Yeah.
And so I got diagnosed, I guess about a year ago now, a little more than a year ago. It was kind of a weird diagnosis or a situation. It initially had presented as stabbing pain in my upper jaw.
Right.
And my first thought was, I have a cavity, I need a filling, mm-hmm. I maybe cracked something. Let me go to the dentist. Mm-hmm. And I went to the dentist and they did all, full x-rays and all exams and everything was totally fine. And so we were like, okay, that's fine. What else could it be? And at the time I was going through a super stressful point in my life. I was at bedside with somebody that was sick in the hospital. I was sleeping in a reclining chair. My posture, in addition to my work posture, was just kind of a mess. So I was mm-hmm. like, okay, there's probably something pinched. There's pinched nerve in my neck, whatever. I go see my physical therapist who's like, there's something weird going on here, but I don't think it's that, but I don't really know mm-hmm. what this mm-hmm. is. And then fast forward maybe 3 or 4 months, and I was walking down the sidewalk on a really cold, windy day, and I got hit with a big gust of wind, and the next thing I knew, I was on the sidewalk, collapsed, crying in pain. And I was like, there's a problem. Something's wrong. We know that this isn't dental. We don't think this is a pinched nerve, and if it was, it probably wouldn't be reacting like this to this environmental trigger. What's going on? I'm really fortunate that I work in a hospital and one with a big neurology department. So it was a really kind of quick and easy, hey, I need help. From my team, who can I talk to? and got linked up with a neurologist that day. Was in the office 2 days later, and he was like, this is textbook symptoms of trigeminal neuralgia.
Right.
We need to confirm with an MRI. So about a week later or so, I went for an MRI, and that's what we got back. So he was right. There was no dental issue. There was no pinched nerve. It's a compression of a nerve in my brain.
Yeah. And okay, that's a really great really great telling of a really bad, awful story.
Yeah.
And just so everybody can get clear on the anatomy, the trigeminal nerve is one of your 12 cranial nerves, which are nerves that go from your brain to points outside of your or inside of your skull. And that is very much why it wouldn't be coming from your neck or from your shoulder. The occipital nerve is the other one that you mentioned. So you mentioned having trigeminal occipital neuralgia, and neuralgia is just a discomfort or symptom related to a nerve, and often a pinched nerve, sometimes a degenerated nerve, sometimes a compressed nerve, right? And all of those things are possible. Trigeminal nerve pain is awful. It is generally what you describe. It often does go into the teeth and making you think that you have a dental problem. It's also a nerve that technically you can't get at directly. And
that tracks.
Yeah, right. In the way that, like, your sciatic nerve, I can't, obviously I'm going through layers of things to get at it, but I can get right next to it and decompress it. You know, if it's coming from your neck, we can decompress things, and presumably with many nerve issues in the neck, we can provide a lot of relief with medical massage therapy or physical therapy or maybe chiropractic or maybe acupuncture. With cranial nerves inside the skull, you can imagine, okay, I can't really get at that there's very few ways in which I would be able to actually get near and decompress tissue that would then decompress the nerve. And we talked about, when you first contacted me, like what kind of likelihood it would be that my kind of work may or may not help you. And I basically said, under these conditions, if this is what's compressing the nerve, I might be able to help you. And if it's not that, then I can't. Right. And so, just to get super duper clear with everybody on like the actual anatomy involved in all this.
Yeah. And, to be fair, and I had mentioned this to you when we had first connected, I had tried sort of a series of different things, and I had seen a couple of other practitioners that, not super successful all the time. Some people were just kind of seemed terrified of nerve pain. Right. And I was like, I haven't found anything besides cold wind that really aggravates it to the point that I can't function. I am willing to try, if you feel comfortable trying this, like I'm willing to try whatever to just get a bit of break, a bit of a relief. And the amount of people, I'm glad that they disclosed that they weren't comfortable, but the amount of people that were like, I don't feel comfortable working with this was, I guess, really surprising. Especially for folks that were advertising themselves or promoting themselves as like pain management kind of specialists. I was like, what's going on? And what other
titles were you talking about? PTs? Were you talking about MDs? Were you surgeons? Like who did you talk to? I'm very So like I had mentioned, it started with my dentist, then I went to my physical therapist, then I went to a neurologist. Right. From my neurologist, once we had a concrete diagnosis, I then went back to my PT for like symptom management stuff, to kind of try to get things to settle down a little bit, which was helpful in the short term. Like short term meaning a day or two. Right. And then, you go home with the battery of exercises of like these things and all kinds of shoulder stuff, but not really stuff going on here that had any sort of lasting impact. I had seen an acupuncturist who, again, was great for some things, but really none of the like stabbing, burning, tingling stuff going on here. I had reached out to several massage folks, knowing that just posturally I have kind of a mess going on here. So kind of figuring like, can I approach it from this way? Because
while I don't necessarily know that these things are connected, they feel it. When symptoms in one place flare up, they tend to both go together. So even if it's not the same mechanism of flare, they just feel related.
Yep.
So I figured, like, can I attack one of it or one thing to get relief from the other? But I had seen and had sessions with 2 other massage therapists that one of them, after the first one, I was like, nope, this is not okay. And I had like maybe 4 or 5 sessions with another. And again, similar to PT, it was helpful for a day or 2, but nothing really lasting.
Right.
Very different style work from yours. I would say probably more just like overall generalized with a bit of weird things going on here.
Okay.
Fast forward, I got a brilliantly targeted Instagram ad at like 2 a.m.
Thanks, Heath Media.
This brilliantly placed Instagram ad, and I was like, it's 2 a.m. I can't sleep because I just rolled over and now I'm having electrical pain in my face, and I just got this brilliantly placed ad. I should probably reach out. This kind of feels like fate. This feels like a sign. And I kind of braced myself. Again, it was in the middle of the night, and I was like, this is weird. Maybe I shouldn't do this. But I did. And to my absolute shock and surprise, you responded quite quickly. And you were like...
I'm a little bit of a night owl, everybody, just so you know.
You responded so fast, and I was like, wait a minute. Hold on, what just happened here?
Did I respond at 2 a.m? I can't.
It was like 3 or 3:30 or something.
Interesting. I might have been up at that hour.
It was quite late / early. And we had spoken a little bit about kind of broadly what's going on, but also some of my lifestyle things. I'm a musician. I have been involved in martial arts for a long time. My sort of third life for early midlife crises, Brazilian Jiu-Jitsu and strength training. And so when you were like, yep, I've been a musician for years and I have also studied, I was like, okay, we're gonna be fine.
Yeah.
And at the very least, you have a clear understanding of the weird things that I do with my body, or the awkward,
the body
or
mechanics, or
like
the biomechanics.
Difficult, not just from a textbook standpoint, and an I've learned about this standpoint, and I've also done this and do this standpoint.
Yeah. And just so you all know, I was a very working rock guitar player for 30 some odd years, semi-pro, let's call it. Really at one point had to decide whether that was going to be fully pro or massage school. Obviously I chose that path, but and I have a black belt in Aikido, so I'm quite familiar with that martial art and a few others. Yeah. I could speak the lingo.
Yeah. So it felt just sort of like comfortable, I guess, of an approach of, okay, this guy gets sort of what my life probably looks like.
Yeah. And just so you all know, it's pretty unlikely I'm going to answer you at 2 a.m. on Instagram most days. We're actually slightly notoriously bad about checking our Instagram DMs, and actually texting us or emailing us is far more likely to get a response. But
got really lucky.
You just, I don't know, somebody was looking out for both of us. So I think when you described all that, I very much approached it as, it's possible I can help you. I would give it a 30%, maybe 40% chance. I've dealt with this before with less than coin toss positive results, because it is not something that it's, as I said earlier, when specific conditions, and I'll get into what the anatomy is on that a little bit, when specific conditions are compressing the nerve and there are things that I can actually manually affect, then I might be able to help you. If that's not the case, and either the nerve is degenerated, or let's say the fossa in your skull that the nerve comes out of your brain and goes through has somehow gotten osteoarthritis and is actually grabbing the nerve, like those, or that's damaged for some unknown reason, which would usually be a tumor, either benign or malign, which I'm sure your MI looked for,
Sure.
MRI. under those conditions, I probably can't help you at all, right? However, I did say that there is a pathway that it runs through that goes very near your sinus fascia and your tear duct fascia and the fascia that I can get at through some inner mouth work that I specialize in. And so there are some jaw muscles inside the mouth for migraines, headaches, TMJ, jaw tension that are pretty amazing, awful to receive for a minute of your life, and then really amazing afterwards. That again, with a slightly less than coin toss percentage of the maybe, I don't know, 24 cases of trigeminal nerve compression I've dealt with in my career, that I can help them, right? And so I was very much upfront, like, hey, these are the odds. I have no idea until we try it, whether it will have any effect at all, but you should know within a session or two whether it's even worth continuing or not, because I certainly won't be like, let's keep going if you don't have any positive effect, right? Because there's, and then we also talked about the idea that, yes, your theory that this holding your guitar at this weird angle while trying to crane your neck around on a hospital bed and play to a sick and dying child might be a little stressful for your, and also stressful from a body mechanics standpoint, biomechanics, and also emotional. Yeah. But this big, and I even think I asked you, like, do you play a big acoustic guitar? Because you're not I'm 6'1", you're not.
That's
and
right.
Having to crane your arm around to strum on a big guitar will really mangle your shoulder, your neck. Yeah. Just inherently, even if you're standing nice and straight, if you got to turn and twist and crane along with that, that's definitely going to have some effect. So this whole line of the arm, shoulder, up into the neck, jaw, absolutely is fascially connected exteriorly. And for headaches, migraine, TMJ, I'm absolutely going to do work up here, but I'm also going to work all the way down the channel for those folks. Yeah. And so the theory was, let's see if a combination of working through that channel and up into the neck, head, jaw, and the inner mouth work could affect your nerve compression. And so under that condition, basically over DM on Instagram, we sort of both said, sure, I'm game if you are, basically. Yeah. And I think the thing that you wrote to me is, you're not terrified of this? And I was like, no, no, actually your story is not even the worst I've heard or dealt with, although it's definitely in the edge case, not normal neck pain, back pain, knee pain that that most of us deal with. But no, your story wasn't that far outside of my sort of norm, if you will, because over my career, I've just gotten used to just a lot of people coming to me with stories like yours of, nobody else can help me. Are you willing to give it a shot? And I'm like, sure. Yeah. I can't guarantee anything, but I'll try, and sometimes I can. And, anyway, so that's kind of how we met, how she booked herself on my schedule, which I'm sure was busy enough that you didn't get to see me for another few weeks or something.
Yeah, I think it was about a month. And then about a month after that, it was like, I think it was an 8-week or so process from, 1 month to session 1, and then a month in between from 1 to 2. Yeah.
So, okay, some of these side questions that Bianca, one of my managers, actually came up with here for the interview are really good ones. So I want to make sure that we're covering some of this stuff, because I could just talk about this forever, and But you sort of talked about the things that led up to you realizing something wasn't right in very good and visceral ways. And you talked about the diagnosis and what the pain felt like at its worst. But then you touched upon this a little bit, but emotionally, what was it like to get the diagnosis and also to go through the process of trying desperately to seek help and not really getting anywhere?
Yeah, it's kind of complicated. As somebody that works in the medical system, I'm probably the worst patient in the world. where it was immediately, it was like, oh, I have a tooth problem, right? And the dentist. And then when that was nothing, and the pinched nerve ended up being nothing, I was like, maybe I'm just making this up. Like, I had a really traumatic event that happened at the end of the summer. So to back up, I had initially had symptoms starting around like April-ish.
2025.
2024.
2024, okay.
By the beginning of June or so, I was in the dentist's office, kind of concurrently with PT of like maybe like a week or two in between. By August, I had this event happen that really kind of shook my life. And as the terrible patient that I am, my first thought was, this is grief.
Sure.
This is emotional pain manifesting physically. And while that's not to say that that's not real, there's not going to be something that shows up on any kind of imaging. This is like a psychosomatic kind of undertext. And when I got smacked in the face with the wind and was on the ground, that was a pretty clear sign that this isn't grief, this isn't psychosomatic, this isn't pain, this is something that's really going on. And so this kind of roller coaster of, it's fine, I probably just need a filling, to what's going on? Like, nobody can figure out what's happening. Like, my PT is really smart and deals with a lot of these kinds of things. Like, he doesn't think that's what's going on. What do I do now?
Right.
And then, into this trauma that happened, and then kind of like a heightened situation of all of the injuries I've ever had in my body for all 38 years of my life, kind of flared all at once. And that's when I was settled on, this is grief. And then I kind of lived in this sort of depression, overwhelm, just like all of the things for about 3 or 4 months. And then, like I said, that wind, I was like, nope, this is it. I gotta go. I have to go see somebody. This feels, I've had other nerve issues before. I know what nerve pain feels like. This feels like nerve pain. What do I do? Who do I go to? Okay, let's try the neurologist first. And fortunately, I had, connections and got right in, no problem. And he actually called out my dentist as a blessing to me. He said, typically when people come to see me and they get to this point of like disease progression or illness progression, they've had so many root canals from dentists that have been chasing the pain. Even though the imaging doesn't necessarily substantiate a need for that, just looking to like find the problematic nerve. So he gave my dentist a beautiful shout out and was like, thank him for that, because you don't need them. This is what's going on. And once I finally had that diagnosis, it was like, oh, it is real. And it was super validating. But then there was almost this sort of reactive rage of, why is my body doing this? This has probably happened, like this has probably been here my whole life. Why now? Did this get exacerbated by this really stressful and traumatic time in my life? Would this have happened if that didn't happen? So like, okay, now I'm mad about it. So how am I going to deal with this, and how am I going to move forward from this? And I would say even still, a year and some change later, I still kind of go through these phases of like, why do I have to deal with this? I don't want to deal with this. There's kind of like no good, clear cure for this, right? There's symptom management, which I'm now kind of on top of and have a clearer idea of what helps and what doesn't help. But, on my really high pain days, I am just annoyed and I'm like, I don't want to deal with this. It's ruining my life. I can't do the things that I love doing. At kind of the height of my symptoms, it shuts me down completely. Where sometimes I can't get out of bed, but also being in bed is uncomfortable because I can't put pressure on my face. So there's no way to sort of feel comfortable in my body. I'm just like, and trying to crawl out of my skin. And then I just have to say like, okay, this is what I've got to deal with. So how am I going to move forward? How am I going to get through it? What can I do to lessen other stress in hopes that that will sort of help settle down the pain in some way. And how am I going to keep going?
Yeah, and just for those of you who haven't experienced nerve pain specifically, I have. I've had a herniation of C5, C6 that lit up all of the nerves in my left arm to a degree that I, to this day, say that if I didn't do what I do for a living and know that it was manageable through manual work and PT, I would have been addicted to opioids within a month because that pain was so, it was a 9 out of 10. Well, let's put it this way. It was a 6 out of 10 constantly. And if I sneezed, it was like somebody stabbed my armpit and dragged the knife all the way down through my middle finger for the next 10 to 15 minutes, right? And that searing, burning, awful, but also normal level of any way I move my head, one of the 3 nerve pathways is going to be on fire. Couldn't sleep, only sleep on my back with no pillow, you know, like that phase of life is really debilitating. And I really, again, just the fact that I know that it's treatable was really the only reason I got through that, you know. And it's mostly under control, and we, you know, you use the word cure, not cure, right? Like very few things medically are actually curable in the sense of how most people understand that word to mean gone forever, right? Like that's actually pretty rare. Even when you know, cure cancer, they talk about you being in remission, i.e. your tests show clear and you don't seem to have anything, but that's not necessarily that you're not going to get some other flare up later. And nerve pain, muscle tearing, labral tear of a shoulder, hip, you know, those things are all manageable, but curable that's a very rare context to be able to apply to anything in medicine at all. The body is just super complex and way more, it's just not a car where if a carburetor breaks down, you put in a new carburetor and it's now cured. That is very, very rare, you know. And so what we're really talking about on this continuum of cure in the super rarest to manage is the most thing, is like how close can we get to the side of mostly manageable with very little effort. And mostly not flaring up and debilitating, you know, and maybe that mostly is even years and years or decades go by without flare-ups. That happens. But then there are other things like migraines or like other things that are manageable and can be helped by varying modalities, including medical massage, but that really the goal is, can we get you to have some sense of agency and control so that you feel like this doesn't just control your life anymore all the time, and you're still going to have some flare-ups and you're still going to have some ups and downs, but hopefully it feels a lot more like you know them, they're a little bit more predictable, you know what the triggers are, and you know, okay, if I put in this many hours at work this week with this many sick kids maybe dying and this much playing guitar, that I might have a flare-up. And I'm choosing that for my, you know, for the sake of whatever or not, right? But that, or whatever, if I go out in the wind, I'm going to wear goggles. To, whatever your management is, like that you actually get to a place where you feel like you have that. And that's really the goal for the work that I do, is to really get to that place of education in your own self and your own body and your own condition, such that you feel like you've got that agency of management, you know, and then maybe that means coming back every once in a while and working with me, but my goal really is that hopefully you don't have to do that very often, you know, if that makes any sense.
I mean, look, we're a different kind of therapists, right? But the whole idea of working yourself out of a job is kind of what we're all going for here.
Totally. And I've had a long-standing goal that my goal is that you don't need me anymore. All right, let me see if there's any more interesting questions, because that was a fabulous answer. So one of the questions we had here is, which you did answer, but I'd like to get a little bit more into it, was, did you ever feel like you were being told it was in your head? And you sort of covered that you kind of did that to yourself.
Sure did.
But did anybody in the medical field also go there and call it psychosomatic, or just sort of dismiss it as psychosomatic at all?
You know, I'm actually really fortunate. Like I said, I am a terrible patient, but I have a phenomenal care team. I tend to have relationships with folks that I see, and even if I see them like once or twice over the course of, you know, a lifetime or whatever, I am really particular with who I'll work with. And if the vibe is off from the beginning, I will not see you again. Like I had mentioned with somebody that I had seen one time, and I was like, nope, this is not. And there was no reason, like there was nothing specific or concrete that happened, but it was like, just kind of a feeling, just like and so, no, I'm really lucky that nobody kind of went that way with me.
Cool.
I also think because I'm well established with my dentist, well established with my PT, they know that I'm not a complainer, and that my pain tolerance is astronomical. I've walked on broken ankles for weeks before finding out that they were broken.
Yeah.
And so when I'm complaining about pain, it's probably there's something going on.
Yeah. And I would say to anybody watching this,
don't do that.
You know, well, I mean, we all do it. I do it too, right? Like, and look, a lot of things are very easy to make into either or context, but grief was probably a factor here. Grief and emotional stress are factors. However, at no point should grief or emotional stress send you catapulting to the sidewalk in writhing pain.
Yeah.
That's, you know, just don't ever think that's psychosomatic, you know. And maybe in some cases, rare edge cases, it winds up being that, but it's very unlikely.
Well, and even like the occipital neuralgia piece of that, I was having headaches all the time.
Yeah.
And that makes sense for what I had just gone through.
Totally.
I wasn't sleeping well. I was under a tremendous amount of stress. And so headaches make sense.
Yeah.
And so it didn't even really flag as a concern or a thing that I needed to seek out like a reason for. And it was kind of more of an incidental finding, like through the trigeminal neuralgia diagnosis. My doctor was like, I really think that this is also going on. And the MRI didn't cover, I guess, wherever or whatever. It wasn't like in the report.
Right.
But we, you know, does it really matter? Not so much. We're not gonna change the course of treatment here.
Well, and sometimes you have to triage treatment, right?
Yeah,
like it's like if you're getting headaches, maybe they're migraines, and maybe that is neurological, and maybe that's related or unrelated or parallel to the trigeminal problem. But it could just be that the trigeminal nerve pain is so strong that you're just clenching your jaw all the time, which is absolutely going to cause a headache. You know? And so, you know, sometimes you have to take triage mentality, which is, you know, something that the hospital people very much are trained in. You know, massage therapists are not always trained to think this way, which is like, treat the worst thing first. And then see if the other things go away.
You put out the giant fires first, and then if there's still little ones,
and so
later.
You know, anyway. We talked about how you found me. We haven't quite gotten into what happened afterwards. So let's talk about the fact that we actually have had some success, knock on wood. And again, I can't guarantee that for any of you out there with trigeminal nerve pain. All I can say is if it's fascially being tugged on by stuff I can affect, then I might be able to help you. So under that, let's talk a little bit about what happened when you first came in. How did that go? How awful was my work?
You know, so I didn't really know what to expect. Like I said, I've seen folks that have called themselves pain management specialists or like practitioners that work with a lot of chronic pain, but I hadn't actually sought out somebody that called themselves specifically a medical focused practice. And I was like, in this context, I don't know what that means. And so I'm not really a pre-Googler.
Okay.
I didn't like dig through your website. I didn't like go Googling your name. because I feel like that will either, I will never come in because I'm going to get freaked out by something that I read, or I just don't find it helpful for me. So, all right, like, let me come in, let me meet you. And I remember just sort of being a little bit nervous because I didn't know what to expect, right? And when, so after the first session, I was like, that was, I don't really know what just happened, because it was so unlike any other session that I've ever been through before. Like, so specific and so focused, but also there was no, how do I say this? I'm trying to be like nice here.
You have to be nice.
There was no, like, you didn't warn me about what was coming. It was like, okay, we're gonna do this, right? And your hands are in my face and my mouth, and I'm like, oh shit.
Caveat,
Sorry.
I definitely warned her.
Well, you said we're gonna do this, and then it was right there,
Okay.
right? And so I am almost glad that I didn't know, because I think if I had a heads up before the session, and God forbid I did like Google this and read about people talking about how painful it is, I simply wouldn't have opened my mouth or been like okay with it. And I'm really glad that I didn't know beforehand. I kind of contemplated every life decision I've ever made in that moment, and was like, did I just make a really big mistake? Like, what's happening? What's happening?
Now, I am gonna just give a little caveat to this, which is that I think your brain has blocked out all of the lead up to what actually happened, because
This is
at
how I
no
remember it.
point, if I do inner mouth with anybody, am I just going to go in there without some sort of explanation of what we're going to do, why we're doing it.
Maybe I was just
And
fully stressed and traumatized.
I think so, and that's okay. But just so you all know, there aren't that many things that I do on the table where I'm like making absolutely sure that you're like, know the anatomy, what we're doing. But that one, because I have to actually put gloves on to go inside somebody's mouth and ask them to open their mouth and get my finger in there, we do talk about it beforehand. You just obviously were so like,
I'm having like a sweat reaction right now thinking about it.
which is okay. But yeah, no, at no point will you just suddenly have my fingers in your mouth. That doesn't happen.
It felt very fast. Or the memory of it was very fast. Guys, I feel like I'm painting David to be this monster, and he's actually an absolute delight. But
okay. What I will say about the work, and I've said this on other videos, our TMJ video, the muscles that I'm talking about here are mostly, there's some others, but there's your pterygoid muscles, which are spelled like pterodactyl, PT. They are your chewing muscles, your side to side, and also protraction, moving your jaw forward muscles. Your big temporalis muscle out here and your masseter muscle are all about closing the jaw. These are about shifting the jaw side to side, and they can only be gotten at from inside the mouth, which is why we do inner mouth work. They also, and the reason I would bother to do this work for her condition, especially the top one, which is the medial pterygoid behind your back molar, that fascially does come up into the sphenoid bone, which is where your sinus cavities are, and into your tear ducts, and that basically is this area of your face. And to the degree that there was a possibility of getting some kind of decompression on your trigeminal nerve, that was basically the main avenue that I thought I could do something about. And I said very clearly, it's a coin toss or less, whether that actually will help you or not. But if it can, then we should try it. Now, one more little caveat just for everybody. The whole process of this generally takes 5 minutes or so, maybe 8 at the very end of a session. And there's a lot of lead up to it. So
Yeah.
it's not 60 minutes of me sticking my finger in
No.
your mouth and working in there.
It may feel like that in the moment, but it is not.
It may feel, as she said, like your whole life choices have been questioned.
Had to question everything. But with all of that said, I was almost completely symptom-free the next day. Heck yeah.
Yeah.
Completely symptom-free by 2 days later.
Yeah.
No
Which actually
tingling.
shocked me.
No tingling, no numbness, my jaw wasn't locking. It was quite literally life-changing.
Yeah.
And you had made a maybe joke about needing to go home and cry or rage.
Yeah.
And while that's not something that I typically do, what I was doing the next day in the supply closet was crying, because it was the first time that I had any sense of nothing going on in my face. And I didn't even realize it until I realized it. And then it was like, wait a minute. My face feels normal. My face feels like it did before this all started. What happened? And then I just fully lost it in the supply closet. So, yeah.
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 And again, that actually surprised me. I would not have bet $1 on that outcome. I would have bet $1 on if we won the coin toss or the less than coin toss, you were going to feel 20 to 30% different.
Yeah.
Not 100% different or 80% different or whatever it wound up being. Like that was actually truly like, what now? Really?
No, it was,
you know,
it was unbelievable. Like I went home and I slept really well that night.
Yep.
Which was, I messaged you at 2 a.m. I don't think I need to explain anymore. And yeah, it was absolutely life-changing.
Yeah. And that can happen with this work. Again, just to be completely ethical here, I cannot guarantee that result.
Sure.
You know, and will not guarantee that result for any condition, let alone for this one. But when it can happen, it can happen. And why we're trying to even have these interviews and these stories is to highlight the idea that like some of these conditions are related to the whole structure and are related to our fascial system and are, you know, this whole line tugging up into here, because we didn't just work in here, we definitely worked through here and on the neck and shoulder alignment and all of that. And so, you know, and just to really tie together like the work and how it would be structured in a session, when I talk about the inner mouth work being maybe a few minutes at the end, it's the idea that that's the capstone after working through the entire lines of fascia feeding up to that space, so that by the time we get there and release those muscles, they actually have a chance to release somewhere. You know, and just to, again, not scare the living crap out of anybody, even though the pain intensity is a 7, 8, maybe even 8.5 on a 10 pain scale, the pressure is that. It's quite literally, that is how much pressure I was applying. It's a tiny, tiny little muscle, and it does not take much pressure to feel terrible. Nobody believes that, but I mean, I didn't believe it the first time I had that work done, when I learned it in a workshop in 2007, you know, and I remember being profoundly impacted by it and having my head balance be this like kind of amazing thing where I was like floating. And I remember my best friend at the time and really great friend still, Cardin Rabin, who went to school with me, who's got a great practice up in Massachusetts if you're ever up there. I remember looking at him, because he was my partner who had done this work on me, and just going, take me to get coffee, and giving him my hand and just having him walk me to the car, because I didn't want to move weirdly, because I was afraid of losing this amazing sense of freedom and balance and just like having all my symptoms drop down, you know. And
I said to my coworker, I feel like a bobblehead right now. Where like things felt like they were in different places and that they were sort of balancing differently and moving differently, and
which they were.
But the amount of space that I don't even know how to explain that, but just it felt like my mouth was 20 times bigger on the inside than it ever was.
Which it's not, but it feels that way.
But it feels that way. No, it was very cool.
Yeah.
Yeah.
So we have a questionnaire for everybody, whether you want to be a guest client. In fact, this might be a nice little CTA, is we do offer guest client appearances if you're interested. However, we don't guarantee that you'll get it. So there's a link below in the description to fill out a form, and if we think you would make a good guest, we may invite you to come in, right? So having done that yourself, and that's partly how you ended up here, this was something that you had actually written that I think is worth mentioning, which is you mentioned wishing you had found more stories of hope. What would you want somebody newly diagnosed with your slightly rare trigeminal nerve compression pain condition to hear, kind of about where things are at and how you're feeling now?
Yeah, so I guess the biggest thing that I would say is don't send yourself down the WebMD, Reddit, Google dumpster fire rabbit hole. The things that I was coming across, they were really disheartening. And I know that people are more likely to complain than they are to, praise or speak highly of something. But the things that I was finding about, I've tried XYZ medications and nothing has helped. I've had X, Y, and Z surgeries and nothing has helped. I've tried the saline injections and nothing has helped. And then to find out that this is nicknamed the suicide disease, because the pain level can be so severe that you can't live with it anymore and you can't deal with it anymore, and so few things are helpful. I really wish that I had come across a story like mine, because I am doing really well. I, for the most part, since coming into your work, more often than not, I'm completely asymptomatic.
Nice.
I occasionally will have a little bit of tingling sort of in my nose, or I'll get a little bit sneezy. The tingling sort of sits here in the corner of my nose.
That symptom. We should tell people about that one.
Yeah, it's really, oh, I just spit. It's really weird. It will sometimes make me sneeze. But on the scale of I can totally deal with this and it's manageable and it doesn't ruin my life, to I'm stuck in bed and can't move and can't do my job and can't do the things that I love to do, I'll take sneezing and a little bit of tingly.
Sure.
But I wasn't coming across any of these stories. I was just coming across people talking about the things that I just mentioned. I can't go to work. Now I'm on disability because I have such bad pain that I can't get through my day. So I would say, while David, you've said so many times, we can't guarantee a positive outcome, if nothing else is helping, try something. Try something different. Try something different with somebody new. Make sure that you find somebody that is like David, though, somebody that really has obviously a very clear understanding of what this condition is and sort of the necessary anatomy and things to make sure that what you're doing is safe. Because as a not anatomy or physiology person, I imagine that there are a lot of ways that these kinds of things could go wrong in the wrong hands. Right, or, at least exacerbate things way more. But try something new. The worst thing that happens is that you don't get relief. Right. But the best case scenario is that you end up asymptomatic for a while.
Yeah. Thank you.
Yeah.
And yes, what I would say is, you in this condition's case, in a way, you're lucky as a filter because very few people in my field will be comfortable. If you come in saying, I've got this stuff, can you help me? Most even very great and experienced massage therapists will probably run for the hills and say, I can't help you, because it takes very specific knowledge and very specific training. Doing inner mouth work even on its own is fairly rare, although most of my staff has been trained by me on it. But even there, that's really useful for TMJ, headaches, jaw stuff, and they're very comfortable doing that. I would hesitate to say most of them have even heard of, let alone worked directly on trigeminal nerve pain, right? Like, I just have a reputation as somebody who doesn't shy away from anything. And a lot of people come into my office and give me an MRI with something I've never even heard of. And I am like, okay, let me Google this right now and make sure I can even work on you, like whether this is contraindicated or not. And if I can eliminate the fact that I shouldn't be working on you, then I'm always willing to say, well, these are the ways that I think that it could be related to muscles, fascia, skin, tissue that I can create elasticity in and maybe decompress nerves or cartilage or whatever, all of the, because let's face it, the work I do is decompressing tissue. That's what manual therapy does, is it tries to create elasticity in tissue. And some of that's on a chemical basis, most of that's on a neurological basis, which is a whole other discussion that we could dive into and spend hours on, but and get into a raging dumpster fire on forums on Facebook and massage forums. But in essence, if I can open tissue and relieve symptoms, then I can help you, and if I can't, I can't. And that's really the truth of it all. And the takeaway, though, is that far and above the limited set of ideas that most people and even massage therapists have about how effective that can be for a very large set of conditions, the actual truth is that it actually can be quite effective when applied properly with good knowledge of anatomy and good knowledge of how things interconnect and good knowledge of biomechanics and how things move or should move and are not moving properly. If you have all of that, you actually can provide relief for a very wide set of far-ranging issues. And basically, having done that work for so long, I get a lot of very interesting and crazy cases on my table, which is fun for me. And I just always approach it like, let's try and see if we can help you, and I can't guarantee anything, and sometimes it really does work.
So. And it's funny, I remember almost like, this isn't the right way to say this, but not like getting my hopes up of somebody who's being like, yeah, this is really cool, let's do it, I was fully ready for you to be like, I don't know. I don't know. Because that, like, I had been met with that so many times. And so it's like, what do you do and where do you go? And like, how do you find an appropriate provider that does feel comfortable working with these things? Again, even, you take the chance and maybe something doesn't necessarily help.
Sure.
But you don't know until you try.
That's right. For the massage therapist watching this, I should say this before we jump, which is that we just last year spent a lot of time and effort updating our website to try to be as clear and as broadly clear as possible about all the different conditions, and we're not even close to covering them all, but we have a very wide range and far more detailed descriptions of what we can do and how and why and when on our website now than we ever had before, and really than most massage therapists ever do. And what I would say is that has absolutely resulted in a massive inflow of the clients looking for that kind of work, which is exactly what we hoped out of that process. All that is for me to say to you, if you're worried about, like, if you want to specialize in something, put it on your website. Be clear about your history with it, even if you don't have any experience with it. If you're just like literally willing to try working on it, you'll get clients from that, and it's worth putting the time and effort into it. And
I would say I'm probably the outlier of somebody that didn't do any of the research.
Definitely are.
I think I didn't want to get my hopes up of like, cool, let's do it, this is going to be great. I almost like didn't want to set an expectation for myself of like, yes, this is totally going to work.
Yeah.
And so let me just go in blindly with no preconceived notions of what's going to happen, or, yeah, so I'm definitely the weird one that didn't do my research.
All right.
Sorry.
No. I'm just looking at time and realizing, like, let's get to it. Harry's going, hey, I have dinner plans.
Sorry, I'm a rambler.
So here's what we're gonna do. You and I are we're gonna take a bathroom break for a second, and then we're gonna stand you up, do a little bit of body reading. I'll point that out. Then we're gonna pull the table out and do at least 45 minutes on the table, including, if you're up for it, some inner mouth work.
It's fine.
And then we'll call it. All right, so Kimberly's standing facing us. I'm just gonna point out a few things. I do want to put on record that we've actually now had maybe 4 to 5 sessions.
Yeah, it was a handful.
And so we've already worked out some of the postural asymmetries that you would normally see in a brand new client that I would point out, and therefore actually looking straight on, you're actually doing fairly well and fairly symmetrical, right? And so there won't be as much for me to point out in these views as there might be with somebody I had never worked with before. So I'm just gonna very quickly point out there's a very slight external rotation of your feet. It's pretty subtle, and we've actually got your wide stance that I think we started with now to be ankles under knees under hips. You can definitely, to my eye, pick up the hypermobile knees here, right? And that's, for the LMTs watching, wondering about this, that's a kind of a dead giveaway, is the knee looking like it's backwards slightly, but that's probably what I saw when I first did this with you in treatment, that had me go, oh, did you know you're hypermobile? And you were like, how did you know? You know.
You actually didn't call that out, but yeah.
Okay, yeah. In my brain, that's probably what I first noticed, but.
Yeah.
From a left-right perspective, the only thing that really stands out to me here is there is still some sense of the guitar into this arm, of a curl this way, but it's pretty subtle compared to when I met you. Mm-hmm. And it used to be that shoulder was up really high. That's generally dropped almost equal to the shoulder next to it. So in general, to me, left-right posture looks pretty easy, pretty balanced. You're also much more on your feet and kind of resting. I think when I first met you, you would not have been comfortably standing on your feet for that length of time, which says that you're both getting better aligned, and also that the training that you're doing and stability work you're doing with your trainer means something good, because you want to just be able to stand there. So just so we have it, let's have you turn towards the door that way, just so we can see a little bit. And so here, you definitely can pick up on the hypermobile knees in side lying if you didn't see it before. And there's a sense that this tibia is actually sort of behind the femur, and that's something we might want to work on. There's also still a little bit of a sense of the rib cage moving backwards and the head moving forwards, although that's much better than when we first met. And I think when we first met, this arm was hanging way out here somewhere, and that's more hanging straight up and down. But that is sort of like a very classic desk posture in the modern world, is to sort of have a slight anterior tilt to the pelvis here, a slight what I call posterior tilt to the rib cage, slight head forward, slight suboccipital fold, right? But everything is much more subtle than when I first met you, which is why it's probably a lot easier to be in your body and stand there. Today, what we're gonna do, we're gonna work some here to try to open up that and bring the rib cage more forward. We're gonna work through here to open up the chest, through the arm, because honestly, given your job as a guitar player, we should never not do that almost. And then we're absolutely gonna work up into the neck and the jaw, and if you're up for it, do a little bit of inner mouth work again today. Yeah. And that'll be the session. So how does that sound?
Sounds good.
Cool. All right, so let's get you on the table. All right, so here's what we're gonna do. We have Kimberly face up. We're gonna go face up the whole session. There are plenty of reasons to work face up, face down, but what I'm coming at today's session's idea of is that to get at neck and jaw, I really think of that starting at the knees and really down at the bottom of the feet, but at least at the knees, we want to open the hip flexors where there was some anterior rotation. We're going to do a little work on the mid-back from underneath. We're going to work up this line, not necessarily right into the sternum, and then we're going to open up the neck and shoulders and end with some inner mouth work. So that's the basics of this. We're also going to do a slightly shorter session because we talked a bunch, so we're not going to do 60 minutes, but we're going to do more like 45 to 50. And therefore, in order to really make sure that the things that I'm doing are actually going to be targeted, I'm just going to work on the anterior line of the body. Kimberly reminded me to say that these bruises she's got on her leg aren't from me, they're from her going back to jiu-jitsu. So I'm going to say that these aren't mine. And it actually is pretty rare that we would cause bruising. All right, let me get a stool. Now I'm working the lateral line of the leg to help open up and take some of that external rotation and help it move a little bit more anteriorly, or internal, I should say. Kimberly, have we done a session where I only work on your lower leg from the knee down?
No.
That's what we're doing next time. Because there's definitely some lingering calf injury, pointed foot ankle stuff going on that would absolutely help all of the top stuff relax more. And had we not been trying to show off some of the work that we're doing for your specific trigeminal issue, I'd probably be doing that today instead. But I won't say that this session is artificial in this context, but it is a little bit meant to highlight something that we basically, this is almost probably exactly what we did in session 1, honestly. I think I had you face up the whole time in session 1 as well. Do you remember?
Yeah, I've actually only ever been face up here.
Really?
Yeah.
Okay, that's unusual.
Yeah.
We haven't done side lying either?
Nope.
Oh, that's really unusual. Okay. Bad therapist, bad therapist. No, joking. Sometimes it works out that way. The other thing I want to say as we're working, I'm reminding myself, is that Kimberly has self-decided to cover her face with a towel. That's not normally how we would do this. On the other hand, we normally don't have super bright photo lights going while we're working face up either, so it's both helping her, as she says, hide her facial expressions, but also it is probably much nicer to have her eyes covered right now.
It's pretty nice.
Is this the calf that you blew up?
Both.
Both.
It's the left side that I walked on a broken ankle for almost 2 months.
We've already talked about this in treatment, but you're too tough.
Sorry.
It's okay, but as somebody who's also probably too tough, I can commiserate on the fact that there are ups and downs to that.
Yeah.
Can you gently flex your foot towards your knee and let that go? And again. And let that go. And again. Let that go. Oh yeah, we're definitely doing a session on your lower legs next time.
Okay.
All right, so now we're gonna work on your psoas, your favorite and mine. Next, we're going to work on your iliacus. These are the two major hip flexors. Not the only hip flexors, but the two major hip flexors.
This side feels so much spicier.
Yeah. Well, this leg, to me, the ankle on this side is noticeably rolled in at the calcaneus compared to the other side. That's just why I was like, oh yeah, we're going to do the lower leg next time. And that's going to travel all the way up the leg into the psoas and the iliacus. But for the top camera, if you want to see why I'm saying that, I'm gently holding, I'm not trying to place her calcaneus anywhere, I'm just seeing where it wants to rest, and the calcaneus is the heel bone, and you can see how both ankles are rolled in, but the left one a little less so than the right one. Without putting much traction on it, I can get the left one to get close to parallel or perpendicular to her body. The right one, not really. It's still got a little bit of an angle to it. And so working on the lower leg, I could hopefully get her feet to be actually functionally grounded, meaning parallel or to the ground or perpendicular to her body, as opposed to angled that way. And that would provide a lot more support for everything above it, but it would take a lot more work than I'm willing to put you through right now. And a lot more focus, because I would spend almost the entire hour from the knee down. And that's something I often do for people with headaches, jaw pain, shoulder pain, neck pain, because I've done a lot, at this point thousands of sessions just from the knee down, and watch somebody's shoulders drop a 1/4 inch without ever touching them. Okay, so now I'm going to slide my hand under the scapula, place my forearm on the lower rib cage, and ask her to breathe up top into my fingers up here, and then breathe out. And we're going to start to see if we can get the rib cage to collapse like it should naturally, more towards the back. Breathe out. Breathe in up here, breathe out. Breathe in up here, breathe out. I'm not pressing hard on this forearm on the ribs, I'm just following them down and helping them stretch. Between each rib there are muscles called intercostals that can stretch. Good. Now I'm working on the pecs, which aren't too bad on this side. Just wait till we get to your strumming arm, guitar strumming arm. Well, and since you're a guitar player, I really shouldn't ignore your fretting hand. Squeeze your thumb much?
Never.
Never?
Never.
Not. What gauge strings do you have on that giant?
This isn't a ball position at all.
What gauge strings are on your giant acoustic guitar that's way too big for you? Are you playing 13s?
They're like a medium gauge. I don't know what they
Yeah,
are.
that's probably 13s.
They're elixir mediums. I don't know what the gauge is. But they feel good and they sound good.
Bronze?
Bronze.
Yeah, that's probably 13s. Which, for the non-guitar players watching this, translates to, it takes a lot of tension to play a chord.
But they sound so nice.
But they sound so great, so we all suffer. Years ago, I worked with a semi-famous, I won't say more to protect confidentiality, but a semi-famous classical guitar player. And, you know, we sort of determined that they just needed to have a custom designed smaller guitar built for them. And despite the fact that everybody was going to be a purist about the tone, like if she wanted to continue having a career, she needed to compromise a little bit on the tone. And, you know, I myself had to switch from my normal electric guitar 11 to 52 gauge, which was pretty heavy for a guitar player, down to 10s. 10 to, you know.
I feel like my guitar is not that big.
Honestly, we should just get you an electric with a speaker built in.
They're pretty sweet.
They make them.
They're pretty sweet. It's like a very small, very light parlor-sized carbon fiber. It's
Okay.
lovely. Sounds great, feels great.
I like a parlor size. I have a parlor size acoustic guitar. My Gibson 1966 of all that. But it's a great songwriting guitar. Great finger style. Finger style sounds great on it. Chords, but
Oh my god.
so what she's complaining about is I'm going right into her pec minor, through her pec, doing a little cross fiber friction. And given what she does with this arm, that is not at all surprising. My own pec minor is just basically glue at this point from 30 years of playing guitar and doing this for a living. And I mean just glue. Gently slide this away. You don't have to pick up your head. Oh well.
Sorry.
It's all right. I may need to take the towel away. We'll see how that goes. You leave it for now. I just devised a new homework assignment for you in my brain that I'm excited to show you. Let's both try and remember, because I won't 20 minutes from now when we're actually going to be showing you, or 25 minutes. When it's time to remember that piece of homework, I will have completely forgotten that I said that. So I'm putting myself on record with you right now so that hopefully one of us will remember, hey, you said you had some new homework. For the LMTs watching this, you could just have a little notepad next to on the desk of your office and write notes like that down to yourself during the session. And as long as it's valuable for the client, the fact that you took your hands off of them for all of 30 seconds to write that note would still be useful. I just never got into the habit. Now, so the next series that I'm doing, I'm not going to go line, muscle by muscle describing everything. Honestly, I have a head, neck, jaw workshop that teaches these whole routines. It's a 2-day workshop in New York City. But I will say, basically, my goal is to go posterior layer by layer, so surface to deep, and then anterior layer by layer, surface to deep. For the posterior, that's really talking about at least 2 layers of tissue, if not 3. And on the anterior, you're definitely talking about at least 2 layers. Sometimes, if you really want to do some deep work, 3 layers. And when we're talking about layers and how deep this is, I'm right now doing a little cross-fiber friction on the transverse processes of our cervical spine, where a bunch of different muscles attach. And one thing I'll say about some of these attachment points is that they're very high value. You do not need a lot of effort or pressure to produce a good result, and this may feel like a 5, 6, or even 7 on clients, but does not take a lot of effort on your part as a therapist, but very, very useful. You're getting scalenes, levator scapulus, splenus cervicus, all right in there. A little bit of suboccipital work here. We'll come back to this. What I want you to do, Kimberly, is think about letting the base of your neck and the back of your throat fall backwards while the head rolls forwards gently. Yep, that's it. So the neck falls backwards, the head falls and rolls forwards. So you're not lifting your head, you're just letting these stretch. Yeah, nice. Good. SCM is a hard muscle to work on, but very, very, very important, especially in the modern day with all of our devices and looking down at our phones and computers and laptops. It's also a muscle that, as long as you know how to safely work on it, is not very difficult to work on. The trick is knowing how. Very slowly try to turn your head even further towards the right. Slow.
So many crunchies.
Yeah. People forget about subclavius, this little guy right under your clavicle. That can get super stuck. Not at all something, well, it's totally worth doing a myofascial stroke or 2 on it. And here I'm just working straight down the sternal fascia. Some rare people have a little muscle in here called sternalis. Most people just have their pec attachments there. Sternalis is not that rare, but it's, It's a small percentage of the population that has it. Ooh, hi there.
Still nowhere near as bad as the first time.
Oh yeah, that does not shock me. And just to talk about the intensity of this, it's like, this is not pressure. This is just the fact that these muscles are so unused to receiving work that even just a light pressure like that doesn't look like I'm using a lot of my own force or weight can feel like a 6, 7, 8 on a 10 scale. And actually, if you use too much pressure in here, your client will run screaming from the room and never come back. So don't do that. Check in when you're working in here. And really, you shouldn't work on SEM or scalenes directly from a YouTube video without some hands-on training. This is what I like to call the temporalis smash, where I squeeze both temporalises together and then fascially slide up to the top of your head. It feels like I'm turning off your brain, for most people. Mm-hmm. This temporalis muscle up here that roughly covers this whole thing is a jaw muscle, even though most people would associate tension here as a headache or a head muscle. It comes down and attaches to the mandible and is a jaw closer. Then this masseter muscle that everybody knows is a jaw muscle is generally quite tight on most people these days. Does not take a lot of pressure at all in a trigger point in here to have pretty intense feelings. And I don't mean emotional ones, although those could be there too. Do me a favor and very slowly open and close your jaw. Yeah, I made that the wrong. Medium, nice and easy, open and close it. It just kind of, yeah, that's, there we go. Good. Back in the day when I worked at spas, I used to get trades with the facialists, and you know, there's some moves that still feel really good in here and are actually quite effective. This can help open up the sinuses on most people. On you, it's also potentially going to pull apart some deeper fascia. Basically, I'm just spreading from the nostrils out under the maxillary. All right, it is time to get out the gloves. Okay, so the way that this is going to work is that we're going to work on the lateral and medial pterygoids. We are mostly going to be connecting to the attachments of those, although for the lateral, we're really just going to be getting at the attachment at the mandible. We can't really get at the belly because it's literally under the palate. So we're just gonna hold down the attachment and then have her mobilize her jaw to pin and stretch the muscle. For the medial, which is behind the back molar, we can get right into the belly of the muscle, but we're also just gonna hold the point and have her mobilize the jaw, not try to do a bunch of movement or fascial work in there. These are tiny, tiny, tiny little muscles, and if you try to do a lot of work on them, you'll just beat them to hell, which we don't want. What we really want is her brain to get that the muscle isn't moving and learn where it is and then figure out how to fire it. All right, I'm gonna have you open wide, but not as wide as possible, so a little bit wider. And here, going down towards the sort of second, third back of the mandible, we can get at the lateral pterygoid attachment, and I often, in my mind, feel like I'm confused about which one's lateral, which one's medial, but I'm pretty sure I'm right that this is the lateral one. So Gonna have you open a little bit wider, and that's gonna increase the intensity of this. Now, what I want you to try to do is to shift your jaw, adjust your jaw, right, left, right, left. Good, open a little bit wider. Same thing. Now, I want you to try to protract your jaw, which is to push your chin towards the ceiling and open at the same time. And while doing that, can you shift right, left, right, left? Although, yeah, that's no fun. All right, open wide, and we're done with 1 of 4. On a scale of 1 to 10, with knowing that that was about how much pressure I was applying, that right now feels like a 1, I'm gonna guess. How much did that feel like inside your mouth out of 10?
This one wasn't so bad. It was like a 3 or 4.
Okay, and that's because we've done this work before on her, trust me. The first time I did this to her probably felt like an 8. Okay, this will be worse. This is gonna be the medial pterygoid, so open wide. Now we're going up behind the top back molar. Slightly lateral usually to that on most people. There's a web of muscle you'll feel, that's the belly. All right, open a touch wider. Oh yeah, there it is, tight as a drum. Now, while I'm in there, can you move right, left, right, left? Uh-huh. Good. Open a little wider. So, same thing. Yep. Can you protract? I mean, yes, good job. And while protracting, right, left, right, left. Good, open wide, and you're done with that one. That was pretty tough, and we've worked on that a bunch.
Yeah, it was more like a 7.
All right. What we'll do with gloves is turn them inside out and make sure that they go in a hazard bin. All right. So that was 2 of 4. Now we're gonna do the same thing on the other side. And honestly, for most people, this is all of the work. It's just these 4 points held with some movement. There are some different, more advanced things I can also do with people that really, really need it, but I usually don't need to do those things. All right, open wide. This side, being her symptomatic side, is very likely to be worse. I'm gonna guess that feels a little bit more intense on your side. And all right, I'm gonna have you open a touch wider. Can you shift right, left, right, left? Good, open wider. Same thing, nice. Can you protract without biting down to push your chin towards the ceiling? Yes. And while doing that, left, right, or right, left, doesn't really matter. Good. One more time, open wide. Breathe, 2 breaths here. All right, and we're done. All right, that was 3 of 4. This is, I think, gonna be the worst of the bunch. Almost always is on most people, but for you especially. And this is the one on her that has by far the most chance of decompressing the trigeminal nerve on this side where the symptoms are, and I'm saving it for last. All right, go ahead and open. Okay, ooh, yeah, wow, okay. Open a touch wider if you can, that's tight. Okay, whenever you're ready, let me have you mobilize left, right. Yep, wow. Good. Can you open a touch wider? Oof, okay, breathe. Panic breathing is okay. Left, right, good. Can you protract without biting down? Yep, and shift a little to your right. Yep, that was your left, a little to your right. Good. And while protracting, can you open a little wider and shift left, right, left, right? Good. Nice. Open wide, 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 wide. 2 breaths there. Good job. Wow, that was a stinker. Okay. Scale of 1 to 10, with 10 being I want to throw David out the window and never see him again.
Probably like a 7 or 8.
Okay. Yeah, 8 to me is generally the max that we'll ever get to, and we don't get there very much at all in a 60-minute session, maybe that much, and that's all. If we're getting anywhere near an 8 more than that much time, your nervous system fries out. 6, we can probably average around a 6 for the whole session, and your nervous system will handle that, with the occasional 7s and 8s in there, as long as you then also throw in some 3s and 4s and 2s, just so that the nervous system can actually handle all of it. But if you do a session and it's like a 6 to 7 the whole time, your client's nervous system will hate you. So don't do that. All right, breathe into your collarbones and your armpits. We're all done with the mean stuff. Good, let it off. Last, one of my favorite sort of lollipop at the dentist office moves. And this, in this case, with that jaw work, almost quite literally feeling like you're at the dentist office, is this muscle up front called frontalis, where I just like to do a nice little stroke sideways. All right, you made it. And we're gonna call it for now. So we're gonna turn off the cameras and then make sure that you're not being filmed while you get dressed. And then we'll see how you feel once you're up and moving around. So let's get the ladder out. Again, because we've done a whole bunch of sessions already, not in this podcast, but actually as a client, the changes we're going to get to see before and after sessions are going to be much more subtle. If we had started you in session 1, you would see a pretty big difference. And now that we're at session 6 in our relationship, or 5, somewhere around there, you're just not going to see as much of a difference. And so we're going to kind of breeze through this body reading portion a little bit. But I do notice that your right arm definitely hangs easier, right? Before it was not at all like this, but it was pulling up in this direction as if it still had the guitar to strum. Now it's definitely hanging a little easier. And the legs are a little bit turned in, not much. We didn't do much with that either, so I wouldn't expect to make a major change. But I think if you turned that way, here, there's definitely much less tilting backwards of the rib cage. It's a lot more on her feet. Well, not a lot, but it's to me, it's noticeable that this is less back bent in the mid back, so this is more open, even though we didn't work directly on it. And the neckline and the head is resting easier and more, less out front and a little bit more on top of her whole column and feet, which I like. That is generally going to relieve a lot of symptoms. Is it a huge change? No, but that's partly because we've already done a bunch of sessions. But it is a little noticeable, so it's nice to see it on camera that we have a little bit more of a ear on top of shoulder, on top of body of T1, on top of hip, on top of knee, on top of ankle, which is what we're looking for, is this plumb line of all the major joints. So, nice work. Turn towards me. We're gonna just quickly pull these chairs out. We're not gonna bother putting all the cameras up or anything like that. No, that's fine. We're just gonna do a quick, how are you feeling? What did you notice? How crazy was that? Kind of an outro, which we'll just use the front camera for, because we've already gone way over time. So
Sorry.
No, not your fault, my fault. So, besides the fact that you told me that you're ready to go to sleep now, which is good,
Yeah.
what else did you notice? What are you
Okay. I am feeling really sleepy now, but I just feel more like settled and comfortable and not feeling like I want to adjust and move around a lot. It's very like settling.
Cool. And that's really great to get to, especially this late in the series, right? Again, you're not going to notice by session 6 these massive postural shifts. Usually those show up more like sessions 1 through 3, right? But then we start to get those integrated and settled in, and we can remind your nervous system like what it's like to settle down and to feel it more at ease, which we want, right? Yeah. Also, just so you all can remember, like we had this somewhat never would I have bet on reaction to sessions 1 and 2 where your symptoms almost completely disappeared. They did flare up again a little bit, and now they're going to probably be much more toned down with occasional flare-ups, which is far more manageable. So hopefully in that sense, today's session will give you an opportunity over the next few weeks to just like feel like they're way tamped down, if not gone, which is always good. And when a client is in a place where the series of sessions has basically managed their symptoms down to a very manageable level to gone for a while, let's say, our goal actually becomes, well, how often do you need to follow up, right? Because we don't want to just keep seeing a client every week or every other week ad nauseum forever. We actually want to start to spread the sessions out and start to see where's a good maintenance cycle that keeps everything under control. Is it every 6 weeks for some people? Every 12 weeks is generally can work out for some people. But some super stressed out people might be every 2 to 3 weeks. We'll see. But and I think we're in the phase with you of just trying to figure out, okay, so now what would a maintenance cycle look like? Despite the fact that I definitely still need to work on your lower legs next time. But anything else you want to add about the process or the feelings you're feeling?
Yeah. So for what felt maybe like a dramatic first start to this interview, sessions are not really that stressful. They're actually very comfortable and very relaxing, I guess. Definitely moments of intensity, but like very manageable and like you've said a bunch of times, it's like a few minutes out of a much longer space.
Yeah.
So the dramatics are really not so dramatic.
Well, and just so that you all know, the average person, session 1 or 2 might feel pretty dramatic. Your brain actually then starts to associate the work with your relief. If you hadn't gotten relief and your symptoms were still on a full 100% level and I had done nothing to improve that, I don't think your brain would then process that intensity of session 1 and say, oh, it's fine. But it does actually start to go, oh, no, that didn't kill me. It's fine. And by session 3, 4, 5, people will usually start to ask me, hey, are you being nice to me today? Are you using less pressure? And the answer is actually no. Usually I'm using more pressure. But your tissue changes more quickly and it responds and lets go easier. Your brain also then goes, oh, this guy helps me. He's fine. It's fine. Don't hide from him. It's okay. And generally somewhere around here, session 4 or 5, people start going, oh, that wasn't, yeah, I feel fine. And then maybe even sometimes they're like, wait, I went to sleep? What happened? I'm like, oh, yeah, your brain's really starting to relax and trust the process. So that's all very normal, right?
Yeah.
And it doesn't detract from the fact that session 1 was pretty intense.
It was pretty rough. It was pretty rough.
And, with that being said, we always want to give you the option to call uncle and say, hey, that's a little too much. Can we go less? And we will always do that.
Can confirm.
Yes. All right. Any other thoughts, concerns, questions, hopes, dreams?
Is this where I avoid the homework that you wanted to ask about or mention about?
Oh, thank you. See, I knew that is one of my tricks with my ADHD, that I forgot I had this great idea for homework and she remembered. So I want to show this. All right, let's do this. We're going to get these chairs out of the way here. That's fine. Okay. So this is a really great guitar player pec stretch, right? And so what you're gonna do first, and we're gonna add your jaw and head into this. So you're gonna come close to the wall so that your shoulder's totally relaxed. Yep. And maybe that doesn't feel like much of a stretch yet at all. So if it doesn't, I want you to think about just turning your body until it becomes a stretch through your palm, forearm. Oh, see, yeah, you're hypermobile. It's okay. It's all right.
Was I supposed to feel something there?
Preferably something in here through here. Sorry. Chaos is ensuing now. Drop your shoulder if you can. That's not how this goes. I just put this on backwards.
Do you need help?
No, I got it. There. Okay. So see if you can let your back not arch, drop your shoulder, and then keep that pressing in while slowly turning. Maybe you feel a stretch there now if you breathe into that. Maybe not. All right, well, breathe into it and see, and then what I want you to do is you're gonna turn your head, tilt your head away, and then open your jaw and push your chin towards me so that hopefully we stretch up through here at all. Does that at all get into your... No? All right. On most people, that would have been a very intense stretch.
No.
But on you, we're going to have to come up with something different because you're hypermobile.
I mean, like...
Yeah, no, I see it now. Okay.
Sorry.
And there's where hypermobility gets into. So actually for you, what we really need is, instead of trying to stretch anything, we need to do self-releases.
So what I do for this is I use they're 18 or 24 inch push-up hand, they're parallel bars, and I just hang here.
That's good.
It's the only way that I feel anything.
Okay, so do that. So that's a good pec stretch. I want you to think about turning your head and shifting your jaw and seeing if you can bring that stretch into the side of your jaw and face. Maybe you can, maybe you can't. If you can't, we'll come up with something different.
Sorry.
That's all right. No, this is the thing. You are who you are genetically, and then we have to figure out how to help you. Yeah. And so I'm gonna keep thinking about this, but for now, take that stretch that does feel like something and try and open the front of your neck and jaw at the same time. See if that does anything at all.
The other one is
Yep. That's all right.
hitting down here.
Yeah, and that, I think I did show that to you.
That was an old one from my PT, actually.
Perfect. Great stretch. Yeah, and I do show that all the time, which is getting into the platysma. All right, you're sleepy. Let me have that mic before we have another person run home with one. No.